All right, welcome back to Breakfast Television. Dr. Zach is with us in the studios. Dr. Zach from the AMRC, ER physician there. Good morning to you.
Hi.
Let's talk about celebrity advice.
All right.
We see and hear a lot about it. It's a big business for celebrities. They can make some advice, they can sell some products, they can make a lot of money. So let's take a look at the good and the bad here. First off, let's start off with the bad. I want to start off with Mark Cuban, a guy, you see him in the Shark Tank all the time, so clearly he knows what he's doing right, but
Yes.
maybe not so right when it comes to medical advice.
No, so his advice, from what I understand, was get your blood tested 4 times a year if you can.
4 times a year?
I'm not sure where he came up with that number,
Yeah.
but basically, it's not, in my opinion, more medicine is not better medicine, right? Like, if there are reasons to get your blood tested. There are screening tests. As of a certain age, we should get our glucose tested for diabetes now and then. Our lipids checked for like hypercholesterolemia, that sort of thing. But getting something 4 times a year is not, first of all, it's not necessary. And also, there are harms from doing tests that are unnecessary.
Yeah, what are some of those harms?
Well, you find things. You find things you don't want to find. You find things that are meaningless.
Yeah.
And also, you cause a lot of anxiety, right? So, I mean, I don't think it's a great idea. And there are very good screening tests out there. And in the States, actually, not everyone can afford to do that. That's a whole other thing. Now, Mark Cuban can certainly afford to do it.
On his health care plan, sure.
Exactly. But no, I mean, talk to your doctor. There are certainly reasons to get tested every now and then for prevention reasons and for screening reasons. But 4 times a year is kind of a crazy
Yeah, and if you're getting a test after test after test, you increase the chances of false positives, right?
Absolutely. And the States is kind of, a place for that, where they do these full body scans looking for something. And if you look, you're going to find something. But the problem is it may be nothing important, but it's going to cause you anxiety. You're going to have other tests.
And if we look at the health outcomes, it doesn't increase. It doesn't
That's
help you
the
out at
main
the end of the
thing,
day.
exactly.
Okay, let's talk about Roger Moore, James Bond, also known as James Bond.
He was a pretty good James Bond.
He was a pretty good James Bond, right there on your screen. But Sir Roger Moore, some bad health advice.
Yes, I'm trying to think what his health advice was.
The foie gras.
The foie gras. That's right.
You don't eat it because it'll cause everything. Right?
I'm not saying eat foie gras by any means. I'm not a big fan, and the whole ethics issue is kind of disgusting.
Different story there.
Yes, exactly. But it doesn't. There's no evidence that it causes. He was talking about Alzheimer's disease. He was talking about diabetes. He was talking about rheumatoid arthritis. It's not a healthy food necessarily. It's very high in fat, although not necessarily. Most of it is the good fat, quote unquote. But no, I mean,
there's zero, clinically speaking, there's zero proof that it causes any of those things.
No. You can eat it without fear of causing those things. Yes.
Okay, so listen, we have a lot of examples of bad advice,
Yeah.
but let's talk a bit about good advice. Michael J. Fox among them. He's been such an advocate for health causes, Parkinson's among them. So tell us about Michael J. Fox.
So Michael J. Fox uses his power. These people do have power, right?
Yes.
Because they have a platform and people listen to them. He uses it for good. And unfortunately, for him, it's because he was afflicted with Parkinson's disease. And very young, like at 29, which is much, much younger than most people. Like usually it starts in the 60s, that sort of thing. But he's used it to really spread awareness of Parkinson's disease and to raise funds for, badly needed Parkinson's disease research. So I think he's done a really good job, and hopefully he's made a difference in terms of awareness and in terms of treatments.
I guess you got to, they always say follow the money. If the money is going to go, if the person's doing something to raise money for a charity, it's probably better than someone who's doing something to sell magazines, doing something to line their pocketbook, right? Because then they'll want to make sure you.
And I think not all these people do it. Some of them have the best intentions, but they're led by the wrong people. People are trying to sell them something, and then they have a platform and they sell it, and other people follow them.
And they make the common mistake, well, something worked for me, I have no proof of why, the actual cause and effect behind it, so I'm going to just tell everyone that it worked for me, right?
Yeah, it doesn't mean it works for everyone.
Another good example, though, Angelina Jolie, what she's done.
Yes. So Angelina Jolie there's a kind of genetic predisposition to breast cancer and ovarian cancer. It's called the BRCA1 and BRCA2 genes. And if you have those, you have a very high risk of getting either breast cancer and or ovarian cancer, like 80% and 60%.
Wow.
So the treatment, the preventive treatment that a lot of women choose, and what she chose, was bilateral mastectomy. So getting her breasts removed, and her ovaries actually, oophorectomy. And the breasts obviously can be reconstructed cosmetically, because that's important to a lot of women. But basically, she did that publicly. So a lot of people who know they have that gene will get that done, but they don't do it publicly because it's a very private thing. But she did it publicly to raise awareness, and so other women say, hey, I have a strong family history of breast cancer, ovarian cancer. They talk to their doctor, they get tested, and then they can have this preventive surgery done.
And the earlier you can do that, the better you are, especially for your health outcomes. One last one, I find this one amazing. This is going to fall into the good advice. the Marlboro Man.
Right.
Tell us the story behind him.
So the Marlboro Man, apparently I was looking into it, there are a lot of them, and sadly a lot of them have ended up with lung cancer and other cancers, right? Because as we know, there's a lot of cancers related to smoking. It's not just lung cancer. But so Wayne McLaren, who was an actor and a stuntman and also the Marlboro Man, he ended up getting lung cancer. And he got very sick, and he died from it very young, 51 or 52, and he became a crusader against smoking. And obviously people know, but the Marlboro Man was very cool. He made smoking cool.
He was the iconic figure that led people to believe that smoking is a healthy, masculine, right thing to do.
Exactly. And his brother posted a picture of him in his hospital bed toward the end, showing this is actually what happens to someone who would probably have been a very healthy 50-year-old otherwise.
And I'm sure he saved a lot of lives just by doing that.
I think so, too.
Dr. Zach Levine from the MUHC. We call him Dr. Zach because he's that good. We'll be back on Breakfast Elgin. Thanks so much.
Thank you. Sure.